Good morning, Susie. My name is Mary. I'm your STNA this morning, and I am going to perform catheter care.
Okay.
I'm going to provide hand hygiene until my hands dry. I'm going to pull the privacy curtain. I'm gonna get my table ready. I'm gonna get the supplies that I need. I need Benson and soap. I need a hand towel. I need 2 wash rags. I need a bath blanket. I also need incontinence pad. I also need a pair of gloves. I'm going to fill my basin with warm water. Make sure it's warm enough for the patient. That's good enough. Now I am going back to Susie. I'm going to raise up the bed, and while I have the bed raised, I'll have the side rails raised too for safety. I'm going to raise up the bed. Raise up the bed to your waist level or thigh level or your comfortable level. This is good enough for me. I'm raising up the other side rail. Then I am going to cover Susie with a bath blanket. The bath blanket should keep Susie warm and also provide for privacy. I'm lowering the head of the bed. The head of the bed will be easier on your back. I'm going to place the incontinence pad underneath Susie. That should prevent the bed from getting wet. Alright, Susie, help me roll over on your side. 1, 2, 3. Alright, then Susie's gonna roll over towards me so that I can fix this pad underneath her. And now I'm ready to provide catheter care. I'm only exposing the area that I'm going to work on. I'm verbalizing that there are no kinks in the tubing and the urine is flowing well. A kink looks like this, so there shouldn't be any kinks. So no kinks. And now I am ready to begin. I have 2 my wash rags. I'll dump them in the basin. I'm putting soap on the rag away from the basin. Put soap on each corner. So I have my 4 corners. My first rag, I'm tagging on the catheter and I'm gonna clean around the catheter. So I'm forming a C while cleaning. So that's one. To prevent tagging. I am forming a C on the other side and I'm holding onto the catheter so that it doesn't get pulled on. And then my other rag, I am gonna wrap the wash rag around the catheter and I'm going to clean 3 to 4 inches down. And then I'll do it one more. I'm holding onto the catheter to prevent being pulled on it. And then I'm gonna wrap the catheter around it and then wipe 3 to 4 inches down. That's the wash. Dumping this in the hamper. And then I'm coming back to rinse again. again I'm holding on to the catheter and I'm gonna clean around the catheter, forming a C. So that's one. So I'm gonna clean the other side again. I'm forming a C. I'm holding the catheter and I'm gonna clean 3 to 4 inches down, and one more 3 to 4 inches down. So that's the rinse. And then I am going to pat dry. And I am done cleaning up Susie's catheter. I'm gonna cover her up, put back her covers. I'll get rid of the bath blanket. Sorry, Susie. And then I am going to clean up. I'll dump the water in the sink. I'm rinsing. I'm going to dry the basin. Put back my supplies in storage. At this point, I can take off my gloves. And then I'll go back to Susie, finish up. Put the side rest down. Make sure she has her collar. I'll put the whole bed down. And I'll also put the side row on this side down. I'm going to raise up the head of the bed slightly. And then I am going to open up the privacy curtain. And now I'm ready to do my hand washing. I'm turning off the water. I'm gonna wet my hands and my wrist. I'm applying soap. You wash between your fingers, you interlace your fingers, you wash your nails, you wash your wrist. And you should do the friction for about 20 seconds. And the 20 seconds I just count from 1 to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Now I am rinsing. I'm going to dry my fingers on my hands. And with a new paper towel, I am going to turn off the faucet. And I'm not going to recontaminate my fingers. Dump in the trash. End of the skill.